Often, patients have to have a urinary catheter inserted into their bladder during a hospital stay. But that catheter can be a setup for a urinary tract infection.
You have a catheter that goes into a body space that's abnormal, and bacteria can crawl along that catheter and can get into the bladder and then set up an infection.
A urinary tract infection doesn't always produce obvious symptoms, but if you have an unexplained fever or experience burning or pain in the lower abdomen, speak to somebody on your healthcare team about the possibility of a catheter-associated infection. Guidelines to lower your risk include: before anyone touches your catheter, ask that they wash or sanitize their hands. Also, make sure that the catheter is secured to your leg. And if you're lying in a bed, the urine bag must be placed below the bladder, but not on the floor.
Don't let the bag go above the bladder, and all the urine that's in the bag now flows back into your bladder. You want to keep it a one-way system.
If you have a catheter in your bladder, a urinary catheter, it's easy for people to forget that it's there because it's under the covers. You, however, can remind people every day, by the way, I still have a urinary catheter, do I still need it? And as soon as they can take it out for you so that your risk of a urinary infection can be lowered.
Never leave the catheter in an extra hour. Take it out as soon as possible.
So as important a catheter may be for your treatment in the hospital, it's just as important it not be a cause of an infection while you are there.